going to speak about the national core indicators and some recent data comparisons that we made in order to show how outcomes for people with developmental and intellectual disabilities align with some findings from the general population. So I'm going to spend a little bit of time talking about the history of the national core indicators, which perhaps everybody is not familiar with, update on the current status of NCI, and then talk about some findings from the core indicators about young people living at home, about wellness, rates of obesity, medication use, vaccinations, family income, loneliness, and friendship. NCI, our National Core Indicators, is a voluntary effort by public developmental disabilities agencies around the country, and it was established really by the state DD agencies because they were very interested in measuring their own performance, and performance especially as reflected in the outcomes for people with disabilities. National Core Indicators is a joint effort between the Human Services Research Institute and the National Association of State Directors of Developmental Disability Services. That is, all of the state directors of DD around the country. NCI has been around since the last century. It started in 1997 with a small group of states, states that were beginning to understand the power of measuring outcomes and also the power of using data to understand the performance of their systems. We currently have 40 states plus the District of Columbia as dues-paying members, if you will, of National Core Indicators. California joined recently, and that meant that we gained all of the regional centers in California, 21 of those, and we also have a county collaboration from Ohio. Here's the map of where our states are located. The states in the dark brown are more recent states. We've been very lucky to receive funding over the last couple of years from the Administration on Intellectual and Developmental Disabilities in HHS. They are very interested in this work and have given us money to see if we can expand NCI to all 50 states. More recently, the Administration on Community Living, in which AAIDD is housed, also gave us money with the National Association of State Units on Aging and Disability to develop an outcome survey for people who are aging and for people with physical disabilities. There are now 3 states piloting that survey, and we're very excited about the ability to really be able to perhaps see some cross outcome arrangements between those 2 surveys. Not all the questions are the same, obviously, because the needs are different, but it will allow for a comparison across populations. So NCI measures some very important characteristics of people, including their demographic information, where they live, what kinds of activities they're involved in during the day, whether or not they're working. Unfortunately, not as many of them are working as we would wish. The nature of their experiences with case managers, with their ability to make choices. And I should say parenthetically that the Centers for Medicare and Medicaid Services recently came out with regulations that really stress these important outcomes, meaning they really stress the importance of people making decisions about their lives and also recognizing that people's experience of their supports is perhaps the most important performance metric. We look at the context of people's lives, their friends, their community, whether they feel safe or not, and also a substantial number of questions aimed at people's health and well-being. The National Core Indicators Consumer Survey is broken into several domains, none of which should be terribly surprising to anybody. Employment, community inclusion, choice and decision making, relationships and friendships, and health and safety. Core Indicators uses several different data collection instruments. The heart of Core Indicators is, of course, the Adult Consumer Survey. We also have 3 family surveys that are mailed to families who've got a family member who's a child living at home with a disability, families who have an adult family member living at home, and families who have a family member living outside of the home. We also collect systems level data, including mortality, and we're just in the process of revising our staff stability survey so we can get a better understanding of staff stability among direct support professionals. As I said, there are a number of different data collection protocols, but the big one is the Adult Consumer Survey. And in order to use the Adult Consumer Survey, we ask states to collect a random sample of 400 people in that state that are receiving at least case management and 1 other services. The questions are geared to the kinds of outcomes that I've just mentioned. Then there are the adult consumer, adult family, guardian surveys, and mortality and staff stability. For anybody who's interested in more information about National Core Indicators, there is a wealth of information on our website, which is nationalcoreindicators.org. There you can find the national reports, which reflect data from all of the states that collected data in that past year. The state reports. One of the keys to this whole enterprise is transparency. So all of the data that's collected from the consumer survey, from the family survey, is all made public. There are publications that have been published in juried journals, data briefs on everything from medication use to employment outcomes, the outcomes for people with autism. There are webinars, as well as a new addition to the website, which is a chart generating function, which allows you to go in, pull up any state and any variable that you want to look at, and generate a chart. Now let me quickly go through some of these national norms. They're very interesting. They're more suggestive than anything because the parallels in the data collection approaches aren't obviously identical, but we thought it would be interesting to sort of take a look in a kind of notional way of how folks that are served in our intellectual and developmental disability systems are faring compared to the general population. I think we're all aware that a good number of the millennials are still or again living at home with mom and dad. This shows in a recent Pew Research study that about 56% of those in the 18 to 24 year range and about 16% in the 25 to 31 year old range are living at home with mom and dad. Our folks, many, many more living at home with mom and dad. About 65% in the 18 to 24 age group are living at home, and 56% in the 25 to 31-year-old age range. So still, and that number is probably only going to increase because states really don't have the resources to provide out-of-home placements for a lot of our folks. In terms of exercise, and here I don't really have a national norm to compare it with, so I'm not sure whether our folks are over-exercising, under-exercising, but the CDC says everybody should engage in moderate physical activity at least 3 minutes a day, 3 days a week. Raise your hands if that's you or not. All right. Our folks in the survey, about 75% do not engage in moderate physical activity at least 30 minutes, 3 days a week. And we find substantial variation, which I'll show you with respect to obesity as well. But in looking at that wellness variable, if you will, states vary dramatically in terms of the numbers of people who really are getting out and getting good, healthy exercise. Obesity rates, here, at least among men, our guys are doing a good deal better than the general population, 28% compared to 36%. women slightly worse at 38% compared to 36%. We're able to discuss these issues because a couple of years ago we added body mass index to the survey. So we're able to calculate rates of obesity as a consequence. However, our data shows a more significant range from state to state, again, in the rates of obesity compared to data from the CDC. I should also note, though it's not in this presentation, that we have found a significant correlation between the use of psychotropic meds among our folks in the sample and obesity, which should come as no surprise since we know that's a side effect. Medication use. Some of the national data suggests that 1 in 5 took at least one psychiatric medication in 2010, and among women that was 1 in 4. Our population in the sample, 53% takes at least one psychotropic medication for one or more conditions. We're going to try and zero in on that data by asking more questions about the numbers of drugs that are being taken. And we've also seen a couple of states recently, Georgia specifically and Massachusetts, really take on the issue of over-medication as a result of these data. Our folks do a whole lot better in terms of vaccinations, not just flu vaccination, but this is largely a function of the fact that the further you get away from a structured setting, the less likely you are to be getting these vaccinations if you're a person with a disability. So there's still a significant number of individuals in this data who are living in a more structured living arrangement where the state regs may require that you get these vaccinations. Employment, and this one should make you cry, about 64%, according to the Bureau of Labor Statistics, working in the non-institutional civilian labor force, are folks about 14%. In terms of getting any sort of fringe benefits, about 74% of the general population gets paid vacation time, 67% paid sick leave. That's pretty pathetic in and of itself, but in any event, among those folks who are working, only about 29% of our folks are getting benefits. Family income, and this is really disturbing, frankly, from our family surveys. 46% of families with an adult family member living at home have incomes under $25,000. Of families who've got children, about 40% have incomes at $25,000 or below. The 2011 poverty guidelines showed the poverty level at about $22,000, $350,000. So we have a substantial number of people who we're supporting, and these are families who are getting support, who are in very fragile shape economically. And for a while we were wondering whether this was some kind of fluke given the recession that we've experienced. But we go back 10 years and it's steady. And many of these families also have more than one child with a disability. Loneliness. In the general population, about 80% say they're not lonely, about 20% say they are. Again, the data collection protocols here not strictly parallel by any means, but we do ask that question of the NCI group, and they're about 28% say they are sometimes lonely, and 12% who say they are frequently lonely. And we know that our folks have a more difficult time unless they're supported to be included in their communities, to make friends, and to be actual members of their communities. This one's about friends, again, not strictly parallel, but a question in the general population. Do you have someone to share your thoughts and your time with, which sort of suggests a friendship? And about 88% of folks in the general population said yes. Among NCI, about 3/4 say they have a friend. That's it. I hope you found this data interesting, and if you do, please go to our website, nationalcoreindicators.org, and find out even more. Thank you.